For those of you who watched our Alaska series, you may remember Oregon Anna, who invited us to mooch dock at her cabin near Ukiah, Oregon. That's where I had my first drone flight, thanks to Anna's help. But the Baker City Rally gave us another opportunity to meet up with Anna and Dave, who live in Hermiston, Oregon. We had a blast. Anna and Dave tried out our e-bikes. We picked some fresh corn from the next door neighbors, and it was really good. We shared van tips, and Dave and Anna took us on a little tour of Hermiston, including a seed packaging plant. Not sure what you call it.
Oh, isn't that an amazing smell? Mmm.
It is, so you don't have allergies, right?
Wow.
All farms.
This all the farms in this area. This is, up here would be Pascal.
What does the color represent?
They just represent different farms.
Different farms,
Yeah.
okay. It's not like one's growing this and one's growing that.
No, they just different. The farms, what they look like.
And it's also gave us another opportunity to fly the drone, which was my second flight. And I'm not just waiting to meet up with Anna to fly the drone. I've actually flown it now 3 or 4 times since I met up with Anna.
Kept like grannies hunched over his head going, I can't see. Where's Marcus Welby? Where's Marcus Welby? Get those letters bigger.
You go like that, right? How do I control the camera though? Well, before we left, Anna suggested I interview Dave, who is a veterinarian, a large and small animal vet in Hermiston, and kind of do a video on traveling with pets. And I thought that was a great idea. We don't have any pets, but I know a lot of you do, and you travel with them. So here is my interview with Dr. Dave. We are here in Hermiston, Oregon, and with the people we met back at the beginning of our Alaska trip, Anna and Dave Rademacher. Did I get that right? Rademacher?
Yep.
And Dave is a vet, and I thought it would be great to have him talk a little bit about people who have pets and they're traveling with their pets. I just have pet John, and I don't know squat about animals other than they have 4 legs.
We'll need to get a big carrier, dog carrier, for him to hide in.
Right. They don't make them that size. So I thought it'd be great to kind of get some tips from him about what people should maybe carry with them, the kinds of calls you get from people on the road who are maybe calling and going, we're here and my dog is sick or blah, blah, blah. Did you ever get those?
Oh yeah,
okay.
We get quite a few of those.
And so kind of share those kinds of experiences, and then what people need to carry with them when they're traveling.
Well, theoretically, when you're traveling from one state to the other state, you're supposed to have health certificates, but nobody really does that. But some of the states, California, your great state, will often ask for that. But how many times has anybody ever asked you for that? They never do. So the only thing that I would have is that you have a rabies, have your dog up to date on their rabies, and that's the biggest thing. And whether you have the rabies certificate or not, your vet will have it that we can call back and we can fax or show them that, yeah.
Well, I want to interject something. We crossed the border into Canada multiple times on our trip. Never once did they ask us if we had a dog.
Oh, yeah.
So I thought that was weird because people always say, well, what do you need for the dogs and blah, blah, blah. But
so the rabies, even there, if they do know that you have a dog, a lot of those guys don't know what to ask anyway, but they would ask about your rabies. Otherwise, beyond that, nobody knows. So, but just have it up to date on the rabies and everything. Traveling with your dogs and pets, a lot of times we have the motion sickness and everything, and anxiety issues. So we have a lot of drugs that we can use for anxiety. And one common one that you would have in your own,
you get it from your vet before you leave home.
There's a lot that we can do, but you could even try just Benadryl. That would be something you have in your own closet for that. But you're not supposed to be driving when you're on Benadryl, so that's what you're getting from that. You're getting a little bit of sedative effect with the Benadryl.
But you don't give a dog a full...
Well, we have right here a little spot.
Oh, you do?
Where I can tell you that 1 milligram per pound, so a 25 milligram tablet. They have 25 and 50s, otherwise you go to the liquid for the child's liquid. And that's like, I think 12.5 for a teaspoon. But 1 milligram per pound. So a 25 pound dog, 25 milligram. You get a bigger dog, 50-pound dog, a 50 milligram capsule.
Okay.
And those work pretty good. And you can use Benadryl as an antihistamine for allergies, but for this situation, you can use it up to 4 times a day, every 6 hours. And that's the most you want to use, but pretty safe. But you're using it more because you're getting that sedative effect from the Benadryl, from the antihistamines.
Great.
But there are quite a few other drugs that, through your veterinarian, you can get a lot of anxiety. Prozac, basically, is one. We can also use trazodone and getting through the veterinarian. A lot of those, Prozac and the trazodone, would be good for anxiety issues when they hop in the car and stuff, or truck or whatever. They get a little bit nervous about what's happening.
I think they're going to the vet.
And the other thing we commonly used to use is acepromazine, so to tranquilize them. And you know, a lot of your vets, if you're working with your vets, you can get any one of those drugs. And try them at home first before you just, you know, because we tell you give it to them about a half hour before you take off on your trip, so it has time to work. But I tell everybody, if they're taking them home, if they've never used it, use it a couple days before you go, so you know what your dog's going to do. Because we get calls if they give it to them and this dog wipes out, especially on the tranquilizer. Hey, my dog's about ready to die, what's going on? And it's just because they've tranquilized and they don't know what to expect. So if you've had it at home and use it a couple days before you take off, you know what to expect and it doesn't scare you so much.
Good advice. I need to check with the videographer over here to make sure that it's running. We filmed whole segments before and we forgot to push the button.
Dang.
It's good though, right, John? Okay.
Still moving.
All right.
The other thing too is if you've just gotten a new van or whatever and you're just starting to take your animals, take them on short trips. Round the block. Next time, go a little bit further and just keep increasing your distance so that it's not all of a sudden one time and you're going to Texas
Alaska.
or something. Or Alaska, yeah. And when you get puppies or dogs or cats, get them start them out in a crate and teach them that crate's a nice safety unit. When you have them then in your van, they're not running around all over the place causing you to look around and trying to figure out what they are and have accidents. Plus, it's more of a comfort zone for them. If you're in a new area, that kennel is someplace that they know that they feel safe in, so they can go into that kennel. And I see that happen quite a bit.
And it's good to have something like that because if on the trip and you have to take them to the vet, you've got something to take them in.
Yeah. Or a leash, like we tell them, you know, the crate or the leash.
Yeah, but a cat is hard to leash up.
Yeah, exactly. We've lost a few before they get into the clinic here. So.
What kind of weird calls have you had just from people on the road? And you've asked them if they have certain things.
Well, a lot of them, we're right on the highway here, so we get a lot of the truck drivers because they all have little dogs in there.
I didn't know that.
Oh, big time. And a lot of the, I shouldn't say this too loud, but a lot of the cowboys used to have the bigger dogs. Now they have little dogs that ride up in their comfort zone.
We call them pocket dogs.
Yep, they'll ride with them up in the cab of the trucks and stuff, so that's company.
Oh, so they just
because they're on the road all the time. These
and they
guys.
pull in and just.
They'll pull in or they'll drive right up the big semis. They'll stop right here on the road and just hop out and come in. But a lot of those have had issues in the past, and so they're coming in. Hey, my dog's not doing as well as they used to. You know, you would think lacerations and things like that, but we don't see too much of that. Fleas, that's really more of a common thing that we pick up on them as we're working through. And you know, you may not have had a flea issue where you're at, but if you go to the coast or any place.
Well, fleas used to be a much bigger problem. Now they come out with those.
We have so many different products.
Yeah, it's much
that
better.
are real safe and everything.
Yeah. And ticks.
Ticks, yep, in the mountains and everything. There's a couple good products, real good products that we put on the back. There's one we put orally too, Bravecto, and it's a one-time pill and it'll last 3 months and it'll get fleas and ticks.
Oh.
But the one, if I'm going into a flea area or a tick area, like in the mountains, and I know there's a good chance we're going to go hiking and all that, there's a nice product called Advantic, and you put it down their back, and it stays in the hair follicles, and then it gets secreted out over the week. But it's a repellent and a killer for fleas, ticks, and mosquitoes. So that's a good one if you're, you know, going to go camping for a couple weeks, and you're going to know you're going to be out.
Do they use that on humans at all, or is that not approved
no,
for humans?
not approved.
Okay.
And I wouldn't be able to tell you anyway.
Yeah.
So.
You have to kill me. Anyway.
Yeah, exactly.
Okay.
I'm safe.
The other thing that happens a lot of times is they're in a park or in a new area, and they're running around checking everybody else's garbage. So we call it garbage gut.
Oh, yeah.
Things that you can do if you're concerned, or if you find something that you're really concerned that they got into. We can get them to throw up by using hydrogen peroxide. So hydrogen peroxide would be a good deal to have on hand in your little kit.
Well, now, see, okay, I was in Vermont at my girlfriend's farm, and one of her dogs got into some chocolate, and I discovered it. I didn't know how much chocolate it had eaten. It was a larger dog,
Yeah.
and I told her, and she's almost a vet herself, but I don't know that she dealt with that issue. And she got the hydrogen peroxide. She tried it twice. He still didn't throw up, and then I think she called the vet to find out more. But I understand there's a ratio between how much hydrogen peroxide and the size of the dog. Do you know? Can you
Yeah.
share what that is?
About 10 mils. A teaspoon is 5 mils, so generally about 10 mils. I usually do, if it's
10 mils per what size dog?
Well, I'd
I mean,
probably, in a smaller dog, the 10 mils. As I get bigger, say 30 to 50 pound dog, I'd be using a good tablespoon, if not more.
Okay.
And you give them about 15 minutes at the most. If you haven't thrown up, pop some more in, same amount. And you can do it up to about 3 times. And then if they're not throwing up, you're sitting there getting pretty frustrated what's going on. And always call the doctor. We have some great drugs that we can actually put a little product. It's a tablet. We can put it right under the eyelid. It'll cause them to throw up, and then once they throw up, then we can flush it out. So we don't give them orally,
I see.
because then we don't have any control over it. But we put it up underneath their eyelid, and it'll be absorbed. And then once they throw up, now I don't need it anymore, so then I can flush it out of their eyes.
What are some of the other products that dogs should stay away from? So there's some other things besides chocolate I think I read about. Is it onions or?
Onions, grapes, those would be, a lot of people think grapes.
Oh,
and
grapes, yeah.
playing with those. That some dogs have effect with it and some dogs don't, but you never know. And that's one that'll actually could cause kidney problems and shut down the kidneys. So that's one to stay away from. A lot of the mistletoes and things in the Christmas time would be also things to stay away from.
And then you said yesterday.
Yew plants, the yews, the Japanese yew and stuff, those would be. Those
Oh,
could be-
okay. Because you work on large animals, and you said that sometimes cattle, if they're hungry, they'll start eating pine needles.
Pine needles.
Not
yeah.
that anyone's carrying a cow in their van,
van.
but I just thought that was interesting.
Yeah, no, they'll cause the pine needles will have a product in it, and it'll cause abortions. And yeah, we had one branch that had quite a few last year that I was into.
Okay.
Because the grass around here gets really dry at a certain time, and then they like those needles for
Okay.
whatever reason.
I have kind of a random question. Our son's dog used to always eat horse manure. Why do dogs like to eat other animals' excrement? I'll put that gently.
The flavor and stuff. There's a taste or whatever that they go for, and it's hard to say.
Is it bad for
Watch
them?
when the trimmers come out and trim hooves on the horses and stuff. The dogs will go after those for
Oh, really?
because it has that smell.
Is it bad for them? Will they get sick doing it?
No, they'll probably throw up and stuff on the
Oh.
on the manure and stuff. It
They-
usually doesn't cause a problem.
And what does it mean when dogs eat grass?
We don't put a lot to that. It used to be that they're getting a lot of them, if they thought they needed to throw up,
Yeah.
eat some
My
grass.
son's
and
dog
it'll-
used to do that all the time.
And they'll get them to throw up.
He
And
had a
everything.
really sensitive stomach.
They're carnivores, but even when they're eating out in nature, when they're eating, they're still getting stuff from the dogs or whatever they've killed from their intestinal tract.
Okay, so it's not that grass makes them throw up.
It can.
Oh, okay.
Because
but it's
so-
almost like they know
Feel
they
those
need this.
blades.
Oh, yeah.
It's pretty irritating. So
Oh,
it's
is that what
irritating.
does
to
it?
stuff.
Okay. But they do it anyway because it's like they're sick and they want to throw up. Oh, okay.
No,
well,
I don't know
I
if
don't
I
know if
can
they
put
want
that
it.
to
Okay,
that. But
okay.
yeah, that's what everybody tries to put
Yeah.
that to that. But
yeah.
whether that's true or not, I don't know.
And then you kind of have a kit of things that people should.
Yeah, we can grab a few things here in a second.
Just, and just to demonstrate the
yeah.
kinds of things people
But
should
medicine-wise, and always work with your vet. But simply, the Benadryl is something very simple that you can use. if you get, if you're on a hike or whatever and you got bit, the dog got bit by a wasp or something like that, the antihistamine from the Benadryl will help you there big time. They get bit mostly in the face and in their lips and stuff, so that's a good place to use your Benadryl and have that available for that too. You know, Pepto-Bismol, stomach, like the garbage gut. If we can't get them to throw up, then we can kind of coat the intestinal tract to kind of calm that.
How much do you give them, or does it?
About, well, right here,
it says
about
on
a
this.
teaspoon per 20 pounds.
Okay, all right.
And you can give quite a bit of that. Do not give it to cats. There's just like aspirin in cats. We break down aspirin about one tablet, or about 4 hours, and we break it down. Dogs takes about 8 hours for them to break down the aspirin. Cats will take them about 72 hours. That's why we don't like to give cats any aspirin at all, because shortly you can get a pretty toxic level if you keep giving it to them.
Wow.
So that's one thing.
Good stuff here, dude.
Yeah, but the Pepto-Bismol, 1 per 20, you know, but I tell people if they're calling, I have them give a good tablespoon, and depending on the dog, a couple of them.
I would think a dog would take that stuff pretty easily because it has a somewhat better taste, or not?
It does and it doesn't. A lot of times, most of the time it's refrigerated, but I would tell you even to put it in the freezer for a little bit.
Oh.
Get it really cold, and then, because otherwise you see these dogs come in and most of the Pepto-Bismols on the client or all over the lips.
They
and
look
the
like
mouth.
they're kind of foaming.
Yeah. So it's not as good at tasting as you think it is. So
Okay.
they don't really like
Yeah.
it. So.
And I imagine people should always take those little syringes with them.
That would be a great idea. Yeah, in fact, we have some that are.
Oh. Oh, I remember getting those when you had your wisdom teeth pulled.
Yeah.
They always gave you these to flush out.
We call these hook syringes, and then
Yeah.
if we're having a force feed or water, you can take this one and you can use the water, and then if you have material you have to give them, otherwise you can cut this down and it gets that opening a little bit thicker. So if you're pulling in thicker stuff, you can give that, and then you can put it right in their mouth and
Yeah.
give it pretty easy.
Those are handy to have on hand anyway. You get that something in your tooth. You can
Flush it.
flush it out.
There you go. Good idea.
Great.
Coffin dogs, Robitussin DM would be a good product, and like it says here, about a teaspoon per 10 pounds. And I can get you a copy of this so you can put it.
Yeah, thanks. And gas X.
Yeah, if you
does
have a dog
work
that
on-
gets
that
flu-
works on humans, right?
Yeah,
Okay, that's good to have on hand.
but it works on
There
dogs
are
and stuff
there are
too.
no secrets in a van.
No. Exactly. No, and that's why you might want to have some gas X for the dogs if they're
Yes.
one that has passing gas all the time. And it's really pretty good. And about a quarter of a tablet for smaller dogs, half for medium dogs, and
Okay.
a large one for.
It's a great
large
sheet.
dog.
We'll definitely, we'll put a link to this so people can download it.
And we can stop right now and I'll put a little kit together or
Yeah,
some things
that'd
that
be
we
great.
can,
Thank you.
get back in 2 seconds.
Are you rolling?
Rolling.
All right, well, we have the thermometer in my hand, so we'll talk about that. But just a digital thermometer works great. And this goes obviously in the rectum, and it'll beep when it's done. And normal temperature should be about 100 to 103. 101.5 is an average temperature.
For all dogs.
For all dogs.
Big, little, and-
Yeah, so from 100 to 103, you never know exactly. I keep records of when they come in here, so I can kind of almost tell where one dog might be 102 every time he comes in, and another one might be a little bit higher. And then they've driven in maybe from one of the other cities to get here, and so a lot of times they might be maybe a degree higher, but that's about it. And you can kind
And
of
what about
tell.
cats? What's
Cats
their-
would be about the same thing.
Same thing?
101.5.
Interesting.
Yep. And then obviously if you, like we just discussed, you could put it in a Ziploc or whatever and put the dog's name on it, and that way you don't use it on yourself accidentally. Lacerations, we talked about that briefly. So here's some material that we can, and you don't have to have all this, I'll just show you some things, but if you had a few of these deals, it would work pretty nice. If you have a laceration on a leg, just getting it cleaned up and wrapped up is the best thing, because then the veterinarian can do quite a bit for you afterwards.
Cleaned with water. And
Clean
then-
with water, peroxide, you already
Okay.
have that peroxide to get them throw up. We
Okay.
can use peroxide to clean it up. And just water's enough. And then wrapping it so that they're not constantly licking at it and tearing it apart. And then we have these Telfa pads. This is a small one, but about the same as this. And I like these big ones because then I can use it for whatever. Or if I have quite a bit of bleeding, I can fold it up, double it up, and it'll absorb a lot more, or even 4 times.
And I know my friend who has horses, she uses diapers for.
I'm glad you brought
other
that up
horses.
because that was my next
Oh,
thing.
I'm sorry.
And something, well, if you're running around with kids, really young
Yeah.
kids, then you might have diapers, and diapers work real good because they're real absorbent and pick up quite a bit. And then once you have that, and if you have any ointments around, it doesn't matter a whole lot. You're just going to put that on there briefly. If it's a pretty good laceration that you need to have a veterinarian take a look at, you're just going to try and keep it clean until you get there. Some of them, if they're just, an inch or half inch and they're not real deep, you can just keep them clean and they'll heal together. It's just going to take longer for that to happen. But that's one of the common deals we get in here, that they were hiking and they got jabbed up underneath the foot, or the pads are cut off or whatever. A lot of times the nails will get caught if we haven't kept trimming the nails. And I just brought this, but this wouldn't be necessarily something you'd carry with you, but if you're trimming the nails and keeping the nails short, that helps. Otherwise, if you haven't trimmed the nails and we're going on a hike and they're pretty long, they can get caught on all the wood and stuff, and so you may have one ripped up. It might just be hanging there. Don't be afraid to just grab it and pull it off, or put it in a wrap and so you got it supported, and then bring it to the vet.
Yeah.
We can pull it off for you.
That's why I don't have a dog.
So with that, then putting the bandage over where the cut is, and any one of these tapes will work. This is not an elastic tape. We just call this the white tape, and so it doesn't expand. And sometimes if somebody puts it on and tightens it too tight, you'll get it too tight, and then we won't get circulation back up through. So
Last time I was at the dermatologist, she had this whole box of this kind of stuff, and I asked for a couple of rolls, and she was happy to give them to me. So.
yeah, we use this Elasticon as our last spot, and I'll show you why. If we put that on, this is vet wrap, and it's really nice. It does not stick to you
Oh, right.
and everything, but it'll stick to itself. So we
Gotcha.
can put your
Yeah.
hand up there, and we can.
Yeah, I've seen that stuff.
And I've had in the past, I used to have the hospital call until now they do it all the time. But on burn patients, they'd call us up and get a lot of the vet wrap and everything.
Oh.
But see, it's nice and elastic, and you get it fairly
That's
tight,
nice.
or you can
That's
get it
nice.
fairly loose. And then at the top where that was, then we could take this Elasticon. It really sticks pretty good. And I'm not going to do it because it'll stick to that hair.
What
But
hair?
You can you can tape it onto the top of that and then
stays.
onto the
Oh.
hair, and it'll keep that wrap from sliding down, because as they move, it's going to keep trying
That's
to slide
nice.
down. So
Where do
this,
people buy stuff like this?
from your veterinarian that you
Oh.
always use and
Oh,
go
okay.
to.
Yeah.
Otherwise, at the pet stores, at
Okay.
the farm
So
supplies.
they do sell those at pet
Yeah,
stores.
they'll have some of the stuff. But just think elastic, brand, and stretch. You can have some of this because it works pretty good on certain deals.
Does
but,
it work on mouths? My sister had her mouth taped once in school because she was talking too much.
We've used it here. But that's all good too. There's 3 different size gauze. These we just call the light ones, and then this one, we use this more on the large animal, but it works great and it's cheaper. But at first we might put that on and then get your wrap with your gauze around it to hold it, and then put the tape over it, and that keeps their tongue off of it. A lot of times you've seen the lampshades on dogs, so if they have a laceration and they keep flicking at it, we got to get that tongue off of it so it'll have a chance to heal. So we put
Oh.
the lampshades
Yeah.
on for a couple weeks so they can
Right.
get healed up. Then I just brought, this is a good bandage scissors. It has that little deal there, so we can slide it
you
up
don't
underneath
cut
there
somebody.
when we're cutting it off, and then get it cut, and you're not making more lacerations that you have to keep
Yeah.
wrapping and everything. That can also be used for cutting around the ears, some of the hair and everything. These are more scissors for hair cutting, just like they use on us and stuff. But that helps when you have long-haired dogs to get some of those big old mats out. Speaking of mats, then a lot of people will try to use these little wire brush to get the mats out. It's only going to go so deep, and it's not going to get down deep. What we like to have is get a big metal or a hard comb like that, and you can see this side's open more and this is
Yeah.
not. But you can get in there and get more of those knots and get down to the skin and get all those knots out.
Well, you know, when we wash our own hair with those detanglers, are there dog detangler sprays?
Yeah, the groomers will use a lot
Yeah.
of that. Then these are a little firmer than that. and then they have longer ones. They actually have rakes like this that really are like razor blades. You can cut some of those mats out pretty good.
Yeah.
I didn't want to bring that in though. So.
No.
But that would be simple
good kit.
as far as along with
Yeah.
some of the drugs and stuff that we talked about.
One of these guys.
Yeah.
Yeah. Great. Well, thank you, Dave. I super appreciate this.
Well, I'm hoping it works. It helps everybody.
Yeah.
But don't forget to use your veterinarian, talk to them, and
Disclaimer.
if you're concerned about all that, we'd like to help people.
And if
so.
you're in Hermiston, Oregon, come see them.
Yeah, there you go.
On what highway are you on?
395.
Oh, on 395. We passed you millions of times and didn't know.
Yeah, we're on the south side of 395, of Hermiston. Yeah.
I hope this video helped some of you. A special thanks to Anna and Dave for allowing us to mooch dock at their place and for the interview. Greatly appreciated. Thanks for watching. See you next week. Are you gonna stand there? Oh.